All right, welcome everyone. We're very happy that you can join us today for this first session of the Campus COVID Q&A webinar series. My name is Sue Ng. I'm the Deputy Director in the Office of Administration and Finance, and I will be your moderator. This is a safe space for you to ask questions about COVID vaccinations, boosters, masks, safety measures, and other COVID-related items in place at Hostos Community College. This session is being recorded. Closed captioning is available. You may submit your questions in the Q&A box, or if you are attending by phone, you may raise your hand and I will call upon you to ask your question. Today, your panelists are Fabian Wander, Director of the Health and Wellness Center, and Zack Korenstein, Environmental Health and Safety Consultant. Without further ado, let's get started. I'm going to ask Fabian to introduce himself and explain his role in Hostos. Fabian?
Thank you, Sue. Thank you for the introduction, and good afternoon, everyone. Welcome to Campus COVID Q&A. I'm sure everyone's really excited to talk about COVID today. It's a hot topic, and it's always an evolving topic. And so, today is really about being able to answer questions directly, being able to give some guidance and some comfort in the way we're managing the COVID policies and the health and safety at Hostos. As a Director of Health and Wellness, one of my responsibilities is compliance as it relates to COVID for students. So all students that attend Hostos Community College have to submit their proof of COVID vaccine. If they're eligible for an exemption, they would submit that as well. And the Health and Wellness Office is in charge of reviewing all COVID vaccine uploads and approving them. And this way we can help students have a safe and a healthy spring semester. So that's kind of a quick overview. As we go into this presentation, I'll be able to answer specific questions and give more details about the always ever-changing environment at Hostos. Thank you, Sue, for the introduction.
Thank you, Fabian. I'd like now to introduce Zack Korenstein, and he will explain his role as the Environmental Health and Safety Officer at Hostos Community College. Zack.
Thank you so much, Sue. And I'm so glad you can all join us today for this important session. As Fabian said, we are here to talk about COVID, everyone's favorite subject. As the Environmental Health and Safety Officer, I am responsible for safety overall, compliance, and biological safety, which COVID has kind of fallen into. Oftentimes, I might be dealing with chemicals in the labs, with safety training, with respirator fit testing for some of the allied health individuals, but much of my time here has been devoted to COVID safety. The questions I'll be addressing have to do with what physically we've done here at Hostos in terms of ventilation, in terms of signage, the communication about how to appropriately deal with the reality of COVID in our daily lives, very much on masks. And I'm going to talk about masks today and how that continues to change. And some of the inner workings of physically being in the space now that we are coming back while we still are living with this pandemic. So I'm excited to take your questions. I do hope to give you the best answers possible. And as Fabian also alluded to, I think it's important to acknowledge that this is an ever-evolving situation. What was true a month ago may be different a month from now. So it's important to remember that today is February 2nd. And so Fabian and I are going to try to do our very best to explain the guidance and the policies based on today's information. And of course, whether it be myself or Fabian, we'll give you some qualifiers in terms of understanding what is the information we're giving you in this moment. My hope also is that as we move on, coming back to reality, coming back to work, coming back to our lives, hopefully some of these safety protocols and measures will go away. Not today, but hopefully eventually. I'm not sure if we have any questions quite yet. I certainly do hope that this is led by you, the participants. Sue, I'm not sure if we have any questions coming in yet.
We do not have any questions coming in yet, but I know that both you and Fabian have received a few in advance of this session. So if you'd like to start with those, we can use them, to kind of start this the session. And as people join in, please know you can put the questions in the Q&A box and or raise your hand if you're on the phone, and I will call upon you to ask your question.
Fabian, do you want to go? Do you want me to start?
Sure. Why don't you start and then I'll jump in right afterwards.
Okay. All right, great. So, what I would like to start with the hot topic of masks. Masks have been, as I said, an ever-evolving fixture of the pandemic. I want to go back in time a little bit and then come up to the present, okay? Remember, at the very beginning of the pandemic, there was some communication that we did not need masks. That was very early on, March of 2020, when health authorities were still trying to determine what was the best advice to give to the public. 2 years in, and by the way, this is the third year now we're living with COVID, we do know a lot more in terms of masks, the better masks to use, and the general guidance coming primarily from the CDC. So a lot of you probably remember that this current variant surge of Omicron did create some changes in terms of the guidance from the CDC. That's what I want to focus on. So when CDC made some of these changes in terms of their guidance and their recommendations, by the way, these are recommendations. These are not laws or regulations. These are recommendations, okay? We should consider them seriously and also consider what makes you comfortable as you walk through the day, walk through your life, and walk onto campus at Hostos. The general guidance from the CDC was that we have to improve the masks we're actually using. And to kind of bring this home to Hostos, I want to reiterate the masks that are acceptable and the masks that are not acceptable. At this point in the pandemic, we do not want to see individuals wearing a bandana or a gaiter, the little scarf that can come up over your face, okay? These are minimally protective at best, okay? So again, no bandanas, no gaiters. What is acceptable? Cloth masks from home, cloth masks that you buy and purchase. There's a lot of variations of different types of cloth masks. All of them are acceptable. Surgical masks, okay? Those are typically the blue masks with the ear loops, okay? Also acceptable, a KN95, it's a much better mask, a KF94, as well as an N95. Now let me speak a little bit about these masks and the differences between them, okay? Now a cloth mask, as I said, there's a lot of variation depending on how many layers the cloth mask has, what is the actual material it's being used, okay? And by the way, let me just give you a disclaimer right here. There's a lot of different information about the effectiveness of masks. A lot of this data is being done right now at research institutions all over the world. So some of the numbers, I'm going to give you some numbers, some statistics. They may change and they may be updated over time. But this is based on what I know right now, based on the information that I've gathered for myself. This is also based on my professional experience of being in the environmental health and safety field for about 20 years now. So the cloth mask can protect you, the user. I've seen between 10 and 45%. It's a pretty big range. And again, it depends on how many layers that mask has, okay? Who actually produced it. I've seen cloth masks with a little ventilation as well that can be a little comfortable for folks. So I would say the cloth mask is kind of the first line of defense. The surgical mask, it's not much better. I would say between 30 and 50% effectiveness at protecting you, the user, the blue surgical masks, okay? So cloth mask, surgical mask, then we go up to a KN95 and a KF94. Now, the KN95 is a Chinese regulated mask. This is one right here. I think all of us have seen this, right? Now, the distinguishing factor of a KN95 is that there are ear loops, okay? And typically always a little wire on the nose to squeeze it down on the nose and make it better. I don't have a KF94. That is a Korean style mask, very similar with the ear loops, has a bit of a flatter face. Some folks like that because there seems to be a little more comfort in those masks. And then the N95. This is an N95 here, okay? Now the big difference here, these are head straps. This strap goes to the back of the neck. This strap goes on the top of the head. So aside from ear loop versus head straps, the N95 is actually technically a OSHA regulated respirator, okay? And an N95 is actually very commonly used within the healthcare sphere for doctors and nurses who are interacting with patients. Now, a word about the material. N95, KF94, KN95, and surgical masks have a particular material that is electrostatically charged. This actually helps to filter particles, which include aerosols, liquid particles that may contain SARS-CoV-2. So this is a much better method of protecting oneself with a mask. Now, another quick word on the masks. It is required that you wear a face mask while on campus at all times. This is very important. This is our policy, and this is what we do here at Hostos, okay? You may have noticed in the Omicron surge, more people are wearing masks around the city. I do notice that. Of course, when you come here inside Hostos, you must wear a face covering. You do not have to wear the best mask. It is much better to wear a mask that you are comfortable wearing for a longer period of time. If for whatever reason, the ear loops, the head straps are inconvenient, burdensome in some way, I would prefer that you wear an easier mask to wear that you can easily keep your mouth and nose in when you're interacting with other people, okay? If you are more concerned, wear a better mask, okay? There are many masks available, and I'm going to talk about availability of masks a little later. I think a question will come with that probably soon. But again, you must have your nose and your mouth inside your mask at all times. When can you take off the mask? I myself, I happen to be in my own office, so I'm not wearing a mask, no one's around. When you're eating and drinking, obviously you cannot eat and drink with a mask. Now, should you be fearful of walking by a student who is eating a donut in the hallway? No. This is about risk mitigation, not risk elimination. If you yourself are wearing a mask, whatever mask you choose to wear, and a student is eating, there is no real harm or fear in walking by this student for a few moments, okay? Again, we have to eat, we have to continue to live, okay? So let's not get overly concerned when we see a nose out. I am on campus, public safety and others are enforcing the mask mandate. And for those of you who have your nose out, I ask you, please keep your nose and mouth inside your mask at all times, unless you're eating and drinking, for the safety of yourself and for others, okay? I think I've talked enough about masks for now. I think I need to head over to Fabian for some more discussion.
Yeah, I was just going to answer another question that was posed before we get to the next question in the box. So one thing is every student on campus is, in order to get onto campus, you have to be fully vaccinated, which means 2 shots at this moment. And if you're not vaccinated and you do receive a medical or a religious exemption, then you're required to test negative at any CUNY campus on a weekly basis. It's this really small percentage of students that were approved for medical or religious exemption. So the majority of our students that are on campus are fully vaccinated. One of the questions was related to boosters, which is a new mandate that was put on for our students. And we encourage students, if they're eligible, right, and they're eligible 5 months after the Moderna or the Pfizer vaccine and 2 months after the Johnson & Johnson vaccine, to get that booster. So what it means is if you are on campus and you're eligible now to get your booster, we want you to have your booster in the system by March 1st, okay? Now, what if you're not eligible? So if you're not eligible, we're asking students to get that when they become eligible, to get that booster shot within 30 days after they become eligible. So if I'm eligible today, which is February 2nd, we're asking you by March 2nd to get that booster shot and to upload it onto CUNY first. And so those are the specific requirements. The Chancellor of CUNY had sent out an email. It was on January 25th, directly to all students at Hostos and in CUNY, very specifically kind of communicating those guidelines for the booster shot. But if you do have any questions, any concerns about that, you can certainly email me, and we'll put my email, I guess, in the chat would probably be a good spot. Where you can, ask me questions and I can specifically answer anything related to boosters. So some students cannot get the booster, right? And that might be a medical reason, because maybe their physician feels that they shouldn't get the booster right now. They should wait a little bit longer. And that's perfectly fine. We just ask for that information to be shared with our office so we can then give folks an extension. So as questions come up regarding the booster, that I just wanted to address that because that was a question that came out before our presentation. Sue?
Thank you, Zach and Fabian. There are a couple of questions in the Q&A box, and I'm just going to give you guys the second one only because it related to Zach's discussion about masks. An anonymous attendee asks, will there be K95s available?
I am so glad that you asked that, and I was expecting that question. I'm very happy to tell you here that we have purchased a certain quantity of KN95s for distribution. At this moment, we have available KN95s at each public safety station in the lobby of each building. In addition to the KN95s, we also have surgical masks also with public safety in the lobbies of each building. Now, I would ask that folks who want or need a mask that cannot easily get it themselves, please go to the building. Please just walk up to public safety. There's actually small bottles of hand sanitizer as well available. Please ask for one mask and use it appropriately. Again, nose and mouth in the mask, and we want you to squeeze down on the wire. If you do not want to wear a KN95, you do not have to, okay? And I would also say, if you have the means to purchase your own, please do. I have my stock at home. I've had it throughout the pandemic. I continue to slowly cycle through my masks. The other thing that's important to mention is that, unfortunately, we do not have an endless supply of masks. We have a nice supply at the moment. We will hand them out for anyone who needs them or wants them, but there will be a time when we will be out of masks. Now, a word about usage of masks. I myself wear a mask for about 2 to 3 weeks. I'm not here 5 days a week. Remember, I'm a consultant. And so, I'm only here for a certain amount of time during the week. But I will wear my mask for 2 to 3 weeks. That is not the official guidance BC before COVID. We are now living in AC after COVID. This is the time we're living. These masks are gold, in my opinion. Okay. Take care of them. try to keep them as clean as possible. Take them off with the straps. Hang it on a hook or on a doorknob at home. Let it sit. Over a period of time, the mask is not going to have any fomite or potential issue with it, and you can absolutely wear it again. Now, one other thing I would say about availability of masks, the Biden administration, the US government, has actually released 400 million N95s, the masks with the head straps, the American regulator, NIOSH. These are supposedly available at pharmacies. I do not know exactly when they'll be there, but these are free to the public. You can go to your local pharmacy, kind of check in close to you and see if they have N95s available for you as well. But again, at our public safety stations in the lobby, we do have KN95s available. If they don't have it in that moment, please be patient. They can radio over to Central and make sure that we can provide a KN95 if you do need it. One other thing I would say quickly about masks is the way I like to see it is I have to go outside, I have to wear pants. I have to go outside, I need a mask. And so I need to obtain my own masks to go about the business of my life when I'm not here, right? To go to grocery stores, to go on the subway, to do what I need to do. So it is a part of life now. Again, we have them available for those who need them. I would ask those that have the ability and the means to please purchase your own. So those that really can't get them can get them here at Hostos and of course at your pharmacy if you want an N95.
Thank you, Zach. We have another question that's actually related to the boosters, and I'd love to forward that to Fabian. An attendee asks, can you explain some of the data or reasons why booster shots are so important for those who might not be aware that immunity wanes 6 months after the second vaccination dose?
Sure, and you actually said it in your question that the immunity does wane according to the research right now, 6 months or even earlier shot depending on that individual. So the booster shot gives you that additional protection. I can tell you that right now during Omicron, you're seeing a lot of folks catching COVID, including myself. I had COVID a couple weeks ago. And the symptoms were really mild, and my family had COVID and the symptoms were mild, and we were all fully vaccinated with the booster. I believe that might have helped, maybe the way my body responded to it. And I'm guessing that, again, I can't tell you because the data isn't really out there yet, but it could have been the reason why these symptoms have become more mild. And that's what my hope is, that these vaccinations will help, just like other vaccinations that we've taken throughout our lifetime. So the booster does help you reduce the symptoms if you do get COVID. And I can tell you that I definitely recuperated very quickly, and it felt almost like a mild cold, which is great compared to you thinking about how things were for people catching COVID maybe 6 months ago or so. So I am definitely supportive of the booster shot, and as per the mandate of the governor, all CUNY and SUNY students are required to have that booster shot. So we definitely recommend it. And of course, you can always speak with your individual, your personal physician or any medical provider to kind of get more information if you have any concerns or further questions.
Thank you, Fabian. We have a question from Alex Milsom, who asks, what percentage of staff is vaccinated, not including faculty? And also, when will there be a mandate?
So I work with students directly, so I couldn't really give you that answer because I don't have the data in front of me. I can just tell you from anecdotally, just speaking with colleagues as a staff at Hostos, the majority of people I've spoken to are, they share that they're vaccinated. I think one of the things is if you're not vaccinated, you're required to do that weekly testing. And that has become burdensome for many folks who maybe initially were holding off on getting vaccinated. So having that weekly testing, I maybe encourage more folks to get tested, to get vaccinated. We don't know right now. There has not been a communication from from CUNY Central with respect to mandating staff to be vaccinated. And there has not been any clarification when that's coming down to us. I'm expecting that to happen, but I don't know if that's going to happen. So we're still waiting on that information. I know that there's probably a high percentage of folks, staff vaccinated, but I couldn't tell you. I don't have that exact information. I don't believe Zack does. Do you have that, Zack?
I have some information that I can share, which is that faculty, staff, students, overall CUNY, we have an extraordinarily high vaccination rate. Can't tell you exactly what that is because there's some variation amongst campuses, but it is considerably higher than the New York City averages, and absolutely considerably higher than the national averages, which I think are at maybe 60-ish% right now. We're probably above the 90% range for all individuals, faculty, staff, students at CUNY in terms of vaccination rates. And I just do want to address one other question. I saw someone mentioned they didn't like my term after COVID, but let me clarify. We are still in a pandemic, absolutely. What I mean by after COVID or AC is that we are living in the time of COVID. COVID will be with us in perpetuity. As long as we exist on the planet, it is very likely that COVID will be with us. And so now, in our third year into the pandemic, we're not at the endemic phase yet, but God help us, maybe by the end of the year we will be. It's not a promise and not a guarantee because I have no clue. That's just my hope. But we will always live with COVID from this time on. We have more tools, education, and knowledge about the dynamics of COVID and how to protect oneself. And so we want to ensure that we're providing answers and policies that will do the best for the health and safety of everyone.
Thank you, Zack. There is another question that I think you may be the appropriate person to answer from Elizabeth Wilson. The memo suggests that unvaccinated staff must still maintain 6 feet distance. How is this possible if there is no social distancing requirements in offices and classrooms?
Let's make some distinction between offices and classrooms for a moment. Per the Chancellor's email, he was rather specific that there is no longer any social distance in classrooms. Now, I have heard that there is going to be further clarification coming from CUNY Central. I hope that there is clarification related to social distance. So we do want to distance as is possible and as is reasonable. And what I have shared with others most recently is that at this point in the pandemic, based upon what we know, based upon our vaccination rates overall, and the mandate of masking, we will have to lean more heavily on vigilant mask use and the overall vaccination rate of our population. So unfortunately at this time, within offices, all managers should do the best they can in terms of whatever rotations are possible in terms of staff to keep some distance. But realistically at this point, we cannot keep a specific numeric distance between people at this time. Again, we're going to have to lean more heavily on vaccination, boosting, and vigilant mask use. And that goes for all spaces, offices, classrooms, and others.
Thank you, Zack. Elizabeth had another question. What is the process and timeline for implementing the faculty vaccine mandate? And is there movement making the mandate for staff also?
Yes, I believe the faculty mandate has already gone into effect. So I believe that that's already gone into effect. I'm not sure exactly what the timeline is when they have to have their vaccines in by. So I can't really answer that. As far as the staff mandate, there's a question we asked about a week ago at the meeting with Central, and They haven't not indicated when that's going to happen or if that's going to happen. I'm just using common sense. I'm thinking that it's going to happen, but I do not know when and if CUNY decides that. They're definitely going to communicate that to everyone once that decision is made.
Thank you, Fabian. We have a question from Rachel Cholst. She asks, I've had a number of students that ask me why they need to get the booster after the SCOTUS decision rejecting vaccine mandates. What is the most succinct answer?
Well, I think the most succinct answer is that the governor of the state of New York has mandated that CUNY and SUNY students receive that booster shot in order to stay enrolled at the university. So that's what I would respond to them. I'm not sure. I'm not a lawyer or really knowledgeable in federal legislation and what's happening at SCOTUS. But I can tell you that there is a New York State mandate coming down from the governor, and it specifically names CUNY and SUNY as students having to get that booster shot. So that's what I would recommend, and I would recommend sharing the chancellor's memo if that helps at all.
If I could chime in on that. So the SCOTUS ruling also was very specific to private employers. It was about private employers of 100 employees or more. And the ask that President Biden did, which was having OSHA enforce the vaccine mandate on private employers. As the student said, that was struck down by the Supreme Court. I would say, as Fabian said, we are in New York State, we are in New York City, and we are following those rules. We have to also consider the regional regulations. And to me, I think that ruling is an indication that the states are more responsible for some of these rulings rather than the federal government. I would also say that CUNY as an institution is doing better than the bare minimum of the federal government. And that is CUNY's right, of course, following all regulation and guidelines that are coming from city, state, and federal bodies.
Thank you, Zach. I'd like to follow up with another question for you from an attendee that asks, what steps are being taken to reduce crowding in high traffic and or confined spaces, such as elevators, the ID office, etc.?
So when you come back to campus, if you were on campus in the past and you're coming back in this semester, you are going to notice some differences. There has been some reduction in signage, for example. However, we do have floor decals in areas where people are lining up, be it for the elevator or be it for other high traffic areas. This is a reminder for folks to keep some distance between each other. We're also encouraging folks, particularly when it comes to the elevators, if you are physically able, it's always better to use the stairs than to get into a packed elevator with other individuals. However, I would also suggest, as I alluded to before, that a short period of time in a slightly crowded area while vaccinated, while masked, is not a high hazard situation. We don't want to be in the elevator for 8 hours, of course, but that's typically not how long you might be in a line or in a crowded area. We have to respect each other's space, distance, and again, I would remind everyone, we have to lean on the tools that are, at this point, 2 years in, time tested. Vaccines and proper mask use. That is the two protective layers that are going to be most important for those short duration of time that you may be in a line or in an elevator. I'm gonna speak for Fabian. Fabian, correct me if I'm wrong here, but close contact, okay? The definition of close contact is being within about 2 arm lengths of an individual for 10 minutes or more. Now, this is about potential exposure too. So if you are not interacting with an individual for more than 10 minutes, the likelihood of potential exposure between you and another are very slim, especially if you're vaccinated, especially if both of you are wearing masks.
And just to add one more safety precaution that CUNY has taken is they're now implementing random testing. So whether you're vaccinated or unvaccinated, you might get an email saying you have 1 week to take your test, and you can come onto the Hostos testing center and be tested on campus. So that's just another measure. It's about 20% of people on campus are randomly selected for this testing, and it's a pretty easy, smooth process. I've done it myself, and I found it to be really great and reassuring that even though you're vaccinated, you still being asked to test. It gives an additional protective layer of safety.
Thank you, Fabian and Zack. Zack, we have another question that may be geared towards you. Where can we instruct students to eat lunch since the cafeteria seems to be closed?
That's a good question. So I have some good news on that as well. So the cafeteria can be used for students to eat lunch. And there's still some logistics going on. I know, Sue, you know a little bit about this as well, but there are discussions now with a new vendor for grab and go meals in the cafeteria. That's not happening today. Like I said, there are still discussions going on with this vendor. And so that's probably coming in the next few weeks, Sue, maybe. I'm not sure about the timeline. However, the cafeteria is open for students to eat. I would suggest be distanced in some way, but there are tables and chairs now in the cafeteria. I have noticed students eating in the hallways, on the bridge. That is acceptable, more comfortable to be in the cafeteria, undoubtedly. And that's where students can go and eat.
Thank you, Zack. As to our vendor, we are in negotiations with getting a vendor in for grab and go foods, as Zack mentioned. However, there have been some delays, so we are working on it. And as soon as everything is up and running, we will let the community know. Thank you. We have another question from Rosemary Jimenez. When can I get the booster after having COVID with 2 previous vaccinations shots?
Sure. So what's recommended is after if you've gotten the 2 vaccinations, 5 months after your 2 vaccinations, you should get your booster. If you had COVID, I would have a conversation with my physician with respect to when would be the best time to get that booster shot. But CDC regulations recommendations are 5 months for the Moderna Pfizer vaccine. And if you have the Johnson & Johnson, 2 months after that to get the booster shot.
Thank you, Fabian. So far, I think we've answered the questions that are in the Q&A box. Please, again, as a reminder for everyone, if you have a question, please post it in the Q&A box or raise your hand if you are on the telephone with us. For the time being, I think, Fabian, if you have other questions from previous emails, please feel free to respond to those.
So no, I don't have anything from previous emails, but just thinking about a couple things I wanted to share. So the great thing that has happened, CUNY has opened up the availability for students, faculty, and staff to get tested at any CUNY testing site. So that is great if you feel that you might have been exposed to COVID, but feel okay. I would recommend going to any of the testing sites to get tested. It's really easy. You actually do your own self swab. So for me, I really hated going to get tested because those Q-tips weren't that comfortable for me. But I was able to do it myself, and then you put it in the vial and you drop it in, and it takes a few minutes. It's really easy and comfortable. And I've had some positive experiences with the testing center. So I highly recommend that. to use it. It's for you to use. With respect, I just did want to mention the random testing, which I did as well. If you are selected to be randomly tested, they give you 7 days to come on to any of the CUNY testing sites to get your testing done. If for some reason you're out of the country, you're unable to get tested for whatever reason, then I would then communicate that if you're a student over to Maria Vasquez, our nurse, which is mavasquez@hostos.cuny.edu. That is our staff nurse. If you're a faculties and staff, you can communicate that over to HR. What might happen is after 7 days, if you're not tested, your ID will become inactivated. So you will not be able to swipe and get onto campus because they want to make sure that you test prior to that. And sometimes we need to then reactivate your ID so you can get tested. So if you do get that random email and you have some questions, feel free to reach out to nurse Maria Vasquez, or again, the faculty and staff reach out to Christine Diaz or Denise Gomez from Human Resources Office.
Thank you, Zach. I'm sorry. Thank you, Fabian. I have a question now for Zach. An attendee asks, have HEPA MERV filters in each building been changed since they were installed?
I think that's a great question. And to be perfectly honest, I'm not completely sure. What I'm going to do is I'm going to double check with engineering so that I can give you a completely accurate answer. And I will let everybody know next week in our next session, Wednesday at 2 p.m. for Campus COVID Q&A. I believe that they're on at least a quarterly, if not better, change-out cycle. But like I said, I want to speak to the source before I let everybody know they've been changed out. And I do have some questions I wanted to go through, unless there were some others that we had, just to follow up on masks. Some other questions I've gotten about masks was, do I have to wear a mask if I'm teaching as a faculty member? The answer to that is yes. Now, you may have seen communications in August and September indicating that faculty who were vaccinated can teach without a mask. Again, that was a ways back. That was before the Omicron variant. So because of this particular point in the pandemic, that's been taken away. Faculty must wear masks while teaching in person in the classroom. There's also been some questions kind of related to this in terms of students not wearing masks in the classroom. So again, it's good to know the acceptable masks. The only non-acceptable, bandana and gaiters, surgical mask, cloth mask, KN95, KF94 and N95s are all acceptable. If you have a student not wearing a mask or has a nose out, I would ask the faculty member to kindly ask the student to please put their nose and mouth inside the mask. You can kind of think of it as if there's two students speaking in the back of class, interrupting class, you as the faculty would say something. Now in this COVID era, my expectation would be inside that classroom, you would respectfully ask the student to please put on the mask while in your class.
Thank you, Zach. We have a question from Professor Bernardini, and he asks, prior to COVID, if a teacher was sick, they either A, came in anyway if they felt well enough to teach, or B, canceled their class and informed the department, or C, tried to find someone to cover for them. With COVID, if faculty don't feel well, they clearly can't go in, no matter how mild the symptoms, or they might test positive and be asymptomatic. Should faculty teach remotely, synchronous or asynchronous, until they have a negative test, or if positive, finish isolating? A similar issue applies to staff. Can they work remotely, or do they have to take a sick day?
So if you don't mind, Zach, I'll take the second part, the staff part. Maybe you can talk a little bit on the faculty side of it if you have that response. I can tell you on the staff side, if you test positive or you're not feeling well, we recommend you reach out to our nurse Maria Vasquez, or again, HR, Christine Diaz or Denise Gomez. And if you test positive, what's going to happen is they're going to recommend you stay home and not come on campus. And then they're going to check in with you, a few days later to see how you're feeling. And if you're still not feeling well and you continually, having symptoms, they're going to recommend that you stay home. So you're not penalized in any way. In fact, like I said, I had COVID myself. I went through that experience and that process. And I was able to work remotely. So I was actually working from home and that was fine. I didn't use up any of my sick days. It was just, HR approved it, communicated directly to my supervisor, and then also communicated it to my supervisor again when I was ready to come on campus, that I'm cleared to come on campus. So there is a process in place to ensure the safety of everyone and also to protect our staff and faculty rights. So that's the experience that I've had, and that's been really, I felt very supported by HR, and the nurse also obviously was very caring to make sure I was feeling well and answering any of my questions. So Zach, I don't know if you have anything to add or information you may have.
I don't really have much to add. I think I would just kind of reiterate what you said, Fabian, which is that these decisions really need to be vetted through HR and Nurse Vasquez. Ultimately, they're the ones to help determine your level of sickness and if you should or should not come in. The only other thing I would say is that my hope is that there's additional clarification coming from CUNY Central. But until then, all these questions really must go through Nurse Vasquez and or HR.
And I do see it's indicated by, I think, our new provost, Dr. Wang, that the academic affairs is in the process of developing a protocol for cases like this. So hopefully that information will come quickly and faculty will have more guidance.
Thank you, Fabian and Zach. That seems to be all the answers all the questions in the Q&A box. If you have additional information you would like to share with the community, we still have about 9 minutes in this hour. Feel free to do so.
I'd like just to say that this has been trying for all of us. I think that I speak for everyone when I say I am sick of COVID. We are, as I said, in the 3rd year of this pandemic. And I truly believe that we do have many tools to keep ourselves safe and to carefully re-enter our daily lives. I, for one, am going to go on a vacation soon. I need to get out a little bit, but I'm going to do it very carefully. Not as I did BC before COVID, but in our new lives with COVID, with masks, with tests. And, again, I think that we have an obligation to connect again as a community, not just the Hostos community I'm talking about, but connect again as people, as a community, as a nation. We are getting closer to that. We are definitely still in a pandemic. We must continue to be vigilant about our actions, our behavior. And again, I am very vigilant about mask use. And so I think that's a priority for everybody. But again, I think slowly but surely, we are going to get back to a more normalized reality. One other good thing I want to say is that at the height of Omicron, these numbers keep changing. I think it was about 3,600 cases per 100,000 on January 4th. As of this morning, I think we're at about 330 cases per 100,000. It's a lot better than 3,600. It's still high. We're still in a situation that we have to be vigilant and careful. But I believe strongly we have a lot of the tools and a lot of the knowledge to get a little bit closer. And don't misunderstand what I'm saying. There's no such thing as 100% safety. There is always some risk, whether it be COVID, getting hit by a bus, something worse in our great city. But slowly but surely, we do have to kind of come back to each other, do it safely, carefully, and thoughtfully. And that's what Fabian, I, and the entire community of Hostos is trying to do here. Create the safest environment possible for you to come back to, work, and learn from.
Thank you, Zach. I'd like to take this opportunity to let everyone know if you still have any questions. We still have a few minutes in this hour, so please feel free to drop them in the Q&A box. Fabian, were there any other questions that you might have received in advance of this session that you might want to share, or, again, additional information that you might want to share with this group for today?
Sure. So no, I didn't receive any additional questions, but I do recommend, you can email me at fwander@hostos.cuny.edu if you have any questions for me specifically. And we're going to hold another campus COVID Q&A next week, same time, same channel. And we really hope that, people can send us questions in advance so we can answer those, or we can just answer questions as the questions come up. And we'll keep you updated if there is new information that we receive. We'll share that. The idea of having this campus COVID Q&A is really to be able to answer questions directly as things continuously evolve, and just to be able to hear what are some of the questions that people have, or you as faculty or staff are hearing from students. So we really want to be able to be that voice, so you can also communicate that with your peers or with your students. So thank you all for joining us today, and we highly encourage you to continue to share and send us questions so we could be well prepared to support you through this process.
Since we're now closing upon the hour, and I'd like to respect everyone's time, I'd like to take this opportunity to thank Fabian and Zach for all the valuable information they have provided today. I want to thank all the attendees for coming and sending in your questions. Should you have further questions that we're not able to get to today, please feel free to send them to the covid19@hostos.cuny.edu email address, and we can send you a response. Or just come to the next session. A notification will be sent out to the community shortly, announcing the next Q&A session on Wednesday, February 9th at 2 p.m. Just so you know, there will be a different link for that session. And so if there are no other questions, I'd like to thank you all again, and have a wonderful day. And hopefully we will see you next week.